What you need are leaders who are vulnerable and able to communicate really well and to share in a way that's really open and transparent.
I think we need to be humble before the challenges. I think if we're in leadership positions, we need to be compassionate and show compassionate leadership.
I, within healthcare as a healthcare leader, need to allow the space and the time to allow people to recover, to speak, to connect, to rebuild in a way that is compassionate and human.
It was difficult to lead in a space where I felt so impacted by what was going on, and there were moments where I would break down crying while I was talking. And I felt that I wasn't leading in a way that people needed me to lead, and yet what I heard from people was, oh my God, it was amazing to see you up there and to hear that you were impacted as well.
I was showing up, but I wasn't leading well, and I was not creating a good culture for the team. So we made lots of decisions as an organization, as a team, around how we wanted to work and created new norms. And one of those was to be very, very purposeful about when we work and when we don't work. And I remember initially thinking that we do that for everyone, but I needed to still do things. Someone on the team said, if you don't, we won't. And that was probably one of the best leadership lessons that I had. And so I realized that I had to honor what we all agreed to.
I think impressing upon leaders that in many ways they set the tone. So they create, they're not the only part of creating culture, but they have a pretty significant influence on organizational culture.
Sometimes we think that as leaders we have to have the answers and we need to drive that down. Actually, it's completely backwards. As leaders, we need to be going out and talking to people who do the work and saying, what's your answer? What's your solution to the problems you face every single day? And they will have the answers.
That's been a problem in the healthcare system as well, is that many people think they know what's better, but they're not getting the input from the nurses or the doctors. And it's like, what is going on here? You're not going to be doing this care. You don't understand it. You're not even trying to understand it. You're trying to dictate and tell us what we should do when you should be watching and learning and trying to figure out and working alongside us to figure out what's the best solution.
Connection before content. So before we start meetings, we want to know how everybody is doing. What are you bringing into the circle today? Right? It's about what's in your energy, and can we help you release some energy, that maybe you brought in with you, so that you can be present with what we're doing right now. Right? So it's very, very, it's more than a mindfulness practice. It's a little bit of everything, but how do we make sure that people know we don't want you to drain the tank? We've got to fill the tank up.
The value of a true thank you as a leader. It's something that I've really learned over this period of time. I think it has the best return on investment of anything you can do as a leader. So showing your commitment, showing you lead from the front lines, and then being truly appreciative and saying a thank you.
Just even acknowledging great work that is being done. So just those tidbits, showing gratitude for your colleagues matters too, because we know that that makes their day too.
I think that the leaders have a huge role to play in modeling that good behavior, and also creating that culture where it's okay to take care of yourself, right? And not only is it okay, I want you to.